Today, more than one-third of adults are obese in the United States, and along the Gulf Coast, the problem is even more common. Obesity brings an increase in medical bills, complex medical conditions, and it can drastically change a person's lifestyle. Joining me now is board-certified internal medicine physician Dr. Cheryl Jeffries with Baptist Medical Group to give us information on the effects of obesity and how it's never too late for seniors to make positive changes. Dr. Jeffries, thanks for being here.
Thank you for having me.
Well, it's a pleasure. Well, just to get started, tell us a little bit about yourself and your experience as an internal medicine physician.
Well, as an internal medicine physician, my practice focuses on adults, and I also focus on medical problems, common medical problems such as hypertension, diabetes, hyperlipidemia, obesity, heart disease, and things of that sort. There's also a lot of emphasis on preventative health care.
Mm-hmm. I'm sure a lot of those things kind of go hand in hand.
Oh, absolutely.
Some of the things that we've talked about. Well, you know, we hear a lot of talk about being overweight or what's average in the United States. What's the difference in being overweight and obese?
Okay, well, obesity is defined by the World Health Organization and NIH based on a number called the body mass index, or BMI. And so you determine your body mass index by your weight in kilograms divided by your height in meters squared, and you come up with a number. And the World Health Organization has defined overweight as a body mass index between 25 and 29.9, and obese as a body mass index of 30 or above. Obesity is further divided into three categories. There's obesity, there's severe obesity, which is a body mass index of 35 to 40, and morbid obesity, which is a body mass index of greater than 40.
Mm-hmm. So if we're all not mathematicians and can't make those numbers ourselves, what are, in lay terms, how might you describe that? Or is that just a conversation they need to have with a doctor?
Well, that is a conversation that you have with your doctor. There are nomograms that are available, such as this one here, and you can look up you can find them on the computer. You can look up your height in inches and your weight in pounds and come up with that number, that body mass index number. So for example, if you're 5 feet 7 inches tall and you weigh over 191 pounds, and you're considered obese. So it's very easy to determine, and your physician can provide that number for you and tell you where you fall.
In terms of health risk or just any other type of health problems associated with weight, does it really matter which side of the scale you're on?
Oh, absolutely. The more severe the obesity, the more likelihood that you are to have some associated health problems, and those are extensive. There are a number of medical conditions that are associated with obesity. There's also an increased risk of mortality. So if you're obese, you're 2 to 3 times more likely to die. Obesity is also associated with an increased incidence of heart disease, diabetes, strokes, osteoarthritis affecting the major weight-bearing joints, sleep apnea. And in addition, there are a number of cancers that have an increased frequency associated with obesity.
Okay, great response. So what causes obesity?
Well, there are a few secondary causes of obesity, but in the majority of cases, obesity is a result of lifestyle. It's a result of taking in too many calories and having too little activity. Obesity has become epidemic over the past 30 years, and in fact, it's not only a national problem, but it's a world health problem. The World Health Organization has stated that obesity has doubled since 1980. And as you mentioned earlier, 34% of the population in the United States over the age of 20 are considered obese at this time.
So when you talked in the opening about you do a lot of work with preventive, how do you counsel someone that maybe hasn't quite gotten there yet? And what kind of advice do you offer them and our viewers?
Well, again, we talk about preventative health care all the time, focusing on lifestyle changes. I always encourage my patients to increase their activity level and improve their diets. And in terms of diets, there are a lot of diets out there. Scientific research has shown that there's no one diet that's better than another. The popular diets include low-carbohydrate diets such as the Atkins or Atkins variations, low-fat diets such as the Ornish diet or vegetarian diets, and then just a reduced caloric diet, something like Weight Watchers. All of these are equally effective in terms of weight loss. The patients that are the most successful with their diets keep a food diary and record what they're actually taking in. We also put a lot of emphasis on exercise and increasing your activity. I recommend that my patients start slow with a walking program and increase their walking on a daily basis to get up to about 30 minutes 5 times a week.
What are some questions that they come to you and they ask, and some of the conversations that you might have with someone?
Well, again, you know, what are the risks associated with my weight? How do I lose weight? What can I do to get this weight off? And in addition to the treatment of exercise and diet, there are some other options that are available for the treatment of obesity. But again, the emphasis is on prevention. And the mainstay of treatment is lifestyle changes, diet, and exercise. And the good news about all of it is that even a small reduction in your weight significantly reduces the likelihood that you'll develop some of these chronic medical conditions. So, you know, people look at the numbers and they get very discouraged and they say, oh, gee, I need to lose 50 pounds. But even a 5 to 10% weight reduction reduces your risk of developing some of these diseases significantly. So if you're 200 pounds, losing 10 pounds makes a big difference.
You see that people are more comfortable having these conversations these days?
Oh, absolutely. They recognize the impact of obesity on their well-being, on their lifestyle, on their disability. You know, if you're obese, you're more likely to develop one of these health conditions. You're more likely to be less productive, to become disabled, to end up in a nursing home. So preventing obesity and treating obesity is just imperative.
That's great advice. Any final words for our viewers, or how might they get some more information?
Well, your physician should be able to provide you with a lot of information regarding obesity, give you some information on diets. And again, I did mention that there are also other treatments available. There are some medications that are available in certain instances. And then there is surgery that is available for patients that are morbidly obese that have not been successful with diet and exercise. So there are treatments available, and I just encourage patients to get involved and to develop a plan and to stick with that plan.
Great advice. Thank you very much.
Thank you for having me.
We'll be right back with more coming of age and services designed to help you take the load off.